request Swati Garu to introduce the chief guest.
Good morning, everyone. It is my honor and privilege to be introducing Dr. Smitha Segu. She has completed MBBS from Ambedkar Medical College, Bangalore, MS General Surgery from Government Medical College, Bellary, Master of Chirurgy in Plastic Surgery from Research Institute, Bangalore. Her journey started with Bangalore Medical College and Research Institute in Plastic Surgery Department from the year 2000. As a lecturer for 8 years, assistant professor for 6 years, associate professor for 7 years. Her multiple roles until present are Professor and Head of Unit, Department of Plastic Surgery, BMCRI, Professor and Head of Unit 2, Department of Plastic Surgery, PMSSY, and Victoria Hospital, BMCRI. She has been as a member and taken posts like Treasurer, Secretary in various medical associations and is serving as Secretary of Karnataka, State Super Speciality Association and Treasurer in Association of Burns, Karnataka State Chapter. She has various ongoing research in the fields of burns, has organized many CME's operative workshops and conferences. Since 2015, she is the author of Iceberg Newsletter, instrumental in setting up the Skin Bank in Victoria Hospital campus, academic in charge of the PG Stimulation Lab in PMCRI, editor of BMCRI Bites. She has published and presented various papers worldwide in journals and conferences covering the topic burns, injuries, and researches done related to it. Her part in social organization. Board of Trustee in B.R. Chandrasekhar Institute of Speech and Hearing, Board of Trustee for Brahmaramba Dr. K.S. Sriram Charitable Foundation at Lions Eye Hospital Rotary Club, Siddhaya Road. Subcommittee member for Karnataka Arya Vaishya Charitable Trust, founder of AVA said the Call of the Conscious NGO. Her professional and volunteer experience. She has led a team of 6 during the tsunami of 2004, all along the coast of Tamil Nadu for 1 week, conducting medical camps and distributing relief material. Led a team for rescue operation from India during Nepal earthquake calamity in May 2015. Stayed for 7 days and operated several cases in districts like Dading in Kathmandu. Helped restore electricity to a village by providing them the cables and other materials. Led a team to Coorg and Kerala in 2018-19 during the floods. Conducted medical camps and distributed relief material to many relief centers all over the affected villages. Adopted and renovated 1 government school in Coorg Rural, also furnished about 10 other primary schools with furniture for classrooms. Nodal officer and head of task force for COVID-19 at PMCRI and related hospitals since March 2020. We are really lucky to have you here, ma'am. Welcome once again.
Thank you, Swati. That was a very brief introduction about Dr. Smitha. There are many, many more things to be added and the list keeps going on. So we just decided to choose very few, what we considered is important. I don't know whether there are other things which are more important in the list. Thank you again. Akka, it's my pleasure to call you formally on board. Please, the stage is yours.
Thank you, Swati and Sindhu, for a very, very generous introduction. But let me give you a disclaimer right away. I am a plastic surgeon by profession, not a physician, but I am confident in what I speak about the Delta and the Omicron variant because I've been the nodal officer and the task force head for our institute and the Allied Hospital, which is a state hospital, 5 of them, since the onset of this virus, which has taken the whole world topsy-turvy. And since I was in the management team and then brought about everything like monitoring the patient admissions, making a roster for the nurses, doctors, and a group D, then getting medications, getting equipment, bridge between the institute, the press, and the government, and all that. I think I can talk to you about Delta and Omicron, but please don't take my word for it. So the total disclaimer, I am a plastic surgeon by profession, but I will try and give you all the facts that I know because I've been running as the head of COVID in the institute from the start. I would like to share a screen And thank you for all the clubs that are participated today and want to know and invited me to speak for whatever I know about these two. Thank you all, especially on a holiday, all of you morning meeting here. And I'll share a screen, but not necessarily that I'm going to explain everything on the slide. I'll be talking, and I would prefer to answer questions rather than keep talking to you all. So briefly, I will tell you the differences between the Delta and Omicron and how we investigated, how we treated the Delta and how we are dealing with Omicron now, and the complications of Delta and Omicron and what are the measures to be taken and all. Briefly, after that, I would love to answer questions because I'm sure all of them will have their own doubts after going through all the internet and the WhatsApp messages that you're all getting. And even after I explain, I'm sure all of you will have a lot of questions. So I'll be more than happy to have a more question answer session rather than me just talking to you one-sided. So let me share the screen now. Okay, as we all know, SARS-CoV-2 is a coronavirus that caused the coronavirus disease in 2019 with an outbreak in Wuhan 2019. And by 2020, it spread all over the world and was declared a global pandemic. The pathogenesis of this is dependent on the viral spike protein, which binds to one of the enzyme in it, and then and the transmembrane serine protease, which activates the viral spike. The more the virus circulates, the more the virus will evolve, and most changes have little or no impact on the virus properties or behavior. However, some changes to this led to the emergence of variants that may affect the transmissibility of this virus, how it presents and how severely it can affect us, and how it responds to the vaccines, the treatment, diagnostic tools, or public health and social measures. So depending on this, the WHO identified two variants, which were variant of interest and variant of concern. So what do you mean by variant of interest? A variant with genetic changes that are predicted or known to affect the virus characteristics, such as transmissibility, disease severity, immune escape, diagnostic or therapeutic escape. And this causes community transmission or multiple cases or clusters in multiple countries with increasing prevalence over epidemiological impacts, suggesting an emerging global public health. So what is a variant of concern? This means the definition that through a comparative assessment, it has been associated with one or more of the following changes. That is, there's an increased risk in transmissibility of this disease, or increase in the virulence, that is the severity, or change in clinical pattern with every emerging variant, or it has decreased in effectiveness in public health and social measures, even after applying diagnostics, vaccines, and therapeutics. So this is how this Delta and Omicron look. I know it looks very scary, like a map of some country, but this is how it is. And these are all the variants of the Delta and Omicron, the genetics. And let's talk about a little about Delta. This variant was first detected in December 2020 and became the most commonly reported variant in the country starting in mid-April 21, because the Alpha was the one that was that started in like early, that is March 2020. From Feb, and then mid-April, the Delta variant came. Alpha variant was a milder than the Delta, but then it was a very new virus and none of us knew anything about Alpha. So how we dealt with Alpha is a totally different story, because nobody knew anything about it and everything was new. By the time Delta came in mid-April, we probably knew 5% of the virus, because I can say we don't even know much even right now. So this Delta genome had 13 mutations. It had mutations in the gene encoding the SARS-CoV-2 spike protein, which caused substitutions, which are known to affect the transmissibility of the virus, even though it was the most transmissible virus known till then, but Omicron better now. and it spread more easily than the other virus of corona, not especially like coronavirus, the other viruses also. It caused severe illness and death also. And in June 2021, WHO stated the Delta strain was on its way to becoming the most prevalent strain in the world, which had more morbidity and mortality also. So this variant, which was called as variant of interest, became variant of concern because of the mortality rate. And the vaccines approved or authorized were effective to prevent a severe disease. And nearly all variants responded to the FDA authorized treatment. And the Delta variant was more contagious, 2x than the Alpha. Some data suggested the Delta variant caused more severe illness than the previous Alpha in unvaccinated people. And unvaccinated people remained the greatest of concern because the risk of transmission in the unvaccinated people were higher than in the vaccinated people. Fully vaccinated people with Delta variant breakthrough infections can spread the virus to others. However, vaccinated people appear to spread the virus for a shorter time and a milder disease. And what were the symptoms affected with Delta and the organs involved? So it used to start with headache, fever, sore throat, and symptoms like sinusitis and throat pain in the throat, and then sometimes with gastrointestinal symptoms like diarrhea and vomiting. And it also affected the heart. We had so many patients. In fact, till now we have treated about 13,000 patients in our institute, the highest in any center, I think, in India. 13,000 in a government hospital. So we saw people having massive heart attacks also. They had pericardial effusion, that is fluid accumulating between the heart and its wall. And then it affected the brain. It caused stroke. It caused intracranial bleeding, causing paralysis, and then sudden fainting. And then, of course, they led on to kidney failure. And the worst affected organ was the lung. Obviously, all of you know, it caused pneumonia-like symptoms, and then untreated went on to fibrosis of the lungs, which was almost it could not be revived. There a lot of people went into ICU, and if this fibrosis once occurred, then they almost said it was irreplaceable. But they could control it with broader medications that came up later. So every organ was getting affected. They would get jaundice. There was no organ that was not affecting this corona, as of course lungs being the first one. And then so we had a lot of variant physicians who were working 24/7 to identify the disease progression into different organs in the body. And investigations, of course, we got all the blood investigations done, and about there were some investigations which are suggestive of COVID, and they were called the COVID inflammatory markers like LDH and ferritin and like C-reactive protein and WBC counts and all of them, and ILI and all that. I'm sure most of you would have had somebody in the house who was involved with it or admitted and got all these investigations done. And of course, everybody got CT chest because that was one of the more crucial investigation which showed how much of the lungs were involved, whether it was going to respond to the treatment or whether we had to give higher treatment, or whether we had to put the patient on ventilator or other forms of oxygen treatment that were available there. And then we had to do CT of the brain to see if there was any bleeding. And we had to do investigations on the heart to see if it was affecting the heart. And of course, a lot of people with kidney failure went into dialysis. We had to keep getting investigations for ruling out kidney failures. Then how did we treat them? Of course, we divided them into mild, moderate, and severe disease. And mild treatment, if they were very mild, they were on strict home isolation. And all of you know the kind of home isolation treatment that we were giving, very strict isolation. There were rules for people who were affected, and rules for those people who were treating them in the house also. And it was also spreading to other people in the house. So we had to follow strict home isolation. And for mild to moderate disease, they were admitted in the hospital. and some people were not on oxygen, but they received the rest of the symptomatic treatment. And some of them were on higher methods of oxygen, like just an oxygen through the cylinder or central oxygen, or there was something called a high flow nasal oxygen, which was giving them higher percentage of oxygen. And then we had non-invasive ventilation, and then we had patient who was going in for ventilator. So they were step by step, we were treating them according to their symptoms and their investigations and the need. So we had different kinds of oxygen, and I can tell you that was the worst time where the whole world needed oxygen, especially in Karnataka. I don't know how the state was in Tamil Nadu, but in Karnataka, most of the hospitals needed, I think, 50% more oxygen than what they had. So our government did a fantastic job. Now, I mean, for the third wave, we are all ready to face any kind of problem, but fortunately, it is not so bad. So we had a lot of difficulty in getting the amount of oxygen that we needed during that time. And then ICU was always full. We never had beds for ICU. We lost a lot of patients because of lack of infrastructure, I'm sure. We used to have like 500, 600 admissions per day and 40 to 50 deaths during the Delta variant. Like, you know, if you can follow Hindi, my PGs would come and cry to me saying, "Ma'am, hatta katta 6 foot ka gym instructor aake 3-4 ghante mein mar ja raha hai, ma'am. Kuch nahi kar sakte. We don't have enough oxygen beds. We don't have enough ICU beds. We can't ventilate them." Our PGs who were treating and our doctors were, I think everybody needed some kind of a psychiatric counseling because they could not handle the amount of people dying during the second wave. That it was very pathetic. We all hardly slept for 2-3 hours during the day, I think, because continuously we used to have calls. I have dealt with some 500, 600 calls every day during the first and second wave. So it was a very pathetic situation. So, and then, so we used to treat them like that, oxygen, and then we used to treat them symptomatically for their fever, sore throats, and body ache, and not able to eat and drink with IV fluids and all that. And then steroids were the one step again, because steroids were helping a lot of people bring down the inflammation, because steroid is an anti-inflammatory. So they were on high amount of steroids, and we experienced complications like clots in the blood. So they would come up post-COVID. We saw some patients coming up with clots in the blood vessels, and which caused, like, you know, stroke and heart attacks and pain in the legs and the stuff like that. So we started putting them on blood thinners, either oral or IV blood thinners, and then injection remdesivir came on. So remdesivir was like I think boon for all of us. Though the US and FDA said it was not the drug of choice, I was there. I saw how patients recovered with remdesivir. 2 doses of remdesivir, and if they were mild to moderate, they would just recover in 1 or 2 days. So it was a drug of choice for us, remdesivir, and we saw a lot of patients get better with remdesivir. And then next step was tocilizumab, which was a higher antibiotic, which almost cost 40,000, I think, bucks an injection. So then that was helping a lot of people, even though it was very expensive. Our government gave it free of cost to patients who really deserved it, and the physician team had to acknowledge that they need it. So but the government gave us free of cost that also. Then you got immunoglobulins, and then you got the cocktail therapy, which also was helping towards the end. Even though it was very expensive, we didn't even that the government gave us for certain patients, but all the private hospitals did treat with immunoglobulins and the cocktail therapy. So what happened? But we saw just, I think, 2-3% of people who went on ventilator recovered, but most of them passed away because they all presented late to us. They would go to a private hospital, they could not afford it, or they could not have beds, and when they got very bad, then they would send it to all the government hospitals. So we received all of them very late, and we couldn't do much. So we lost all of them. Most of them we lost. And what were the complications that we saw? Long-term complications were a lot of tiredness and these clots, which were causing a lot of pain in the legs. And some people came back with the deadliest of the complication called mucormycosis. So all of you must have seen during that time. But this mucormycosis kind of like went up like one zoom to the sky, caused a lot of complications. And as fast as it went up, it came down also. I think it was specific to the Delta variant. maybe another variant of the Delta which caused mucormycosis. And it was there only for a month and a half, but it created a lot of morbidity. Lot of people, we had to take off their eyes and their nose and part of the mouth and all that. Now most of them are coming back to plastic surgery for reconstruction of their faces and all that. That was the deadliest complication that Delta variant, during Delta variant where we saw. But we also saw a lot of home isolated patients who recovered fast. Even after a double vaccine dose also, a lot of our doctors got positive with Delta. But then I could see the difference between those people getting positive after the vaccination and those who got positive without vaccination. They were the more severe diseases which needed admission and investigations and treatment. But the ones who got positive after both the doses of vaccine, maybe because of their immunity or because of different variant of the Delta, had a much milder disease which didn't even need hospitalization. Example, I had taken both my doses, and even after 1 month or so after the second dose, I turned positive. But I had a very mild disease, and I was at home for 10 days, and then I recovered totally. So it was like that, the complications of Delta. And then we had this disease-free time for some time. We started our whole hospital of almost 2,000 bed was converted into COVID. So we didn't do any other thing other than COVID being the biggest government hospital in Karnataka. So I had almost forgotten my plastic surgery for some time, I guess. But we started doing non-COVID slowly, and then this Omicron has started now. And what is Omicron? On November 26, 2021, WHO's advisory group proposed the new variant which came, which was commonly known as Omicron. It was first identified in South Africa, and it had 30 different mutations. It is spreading significantly faster than the Delta variant in countries with documented community transmission, with a doubling time of 2 to 3 days. But it is, I think, 6 times more transmissible than the Delta variant. An analysis of the changes in the spike protein indicated that this variant was likely to have increased transmission compared to all the SARS-CoV-2 virus. And severity was in the UK, Denmark, South Africa, which did the initial studies. It was affected there earlier than in India. They said there was a reduced risk of hospitalization, but you cannot definitely call it mild. Like, that's what they said. But there is currently no information to suggest the symptoms associated with Omicron are any different from those of the other variants, but they are much milder. But we are seeing a little different symptoms. We are having stuffed noses, running nose, mild fever, mild throat ache, and then more of GI symptoms. They are having more loose stools and nausea, like some kind of a gastritis. This is over this Omicron. But let me tell you, like we are showing something like 40,000 cases in Karnataka per day, but I would say it was, I think, twice more than that, because most of them who are getting symptoms are not even getting tested now, because if there is one person who's got it positive and everybody else in the house is getting, they all think it's the same thing, and they're either quarantining themselves, treating symptomatically, because we are not treating Omicron with anything else other than symptomatic treatment. Like fever, we give Dolo, and then for a mild sore throat, we're giving antihistaminic like a cetirizine or something, and a cough. Yeah, there are a lot of people are having cough, a dry cough actually, not really an infective cough, but a dry cough with a white sputum once in a way probably. So unless the sputum turns into yellow, green, we're not even giving any antibiotic. So only symptomatic treatment like vitamin C and zinc and B complex. These 3 were also given in Delta variant, and it was given for a long time because we saw a little difference in the bone structure. So we gave them vitamin D for longer time, and we gave them this blood thinners for longer time to prevent clots. So these are all going on for about 2 to 3 months after even their symptoms got down in Delta variant. So now we are only giving that is B complex and vitamin C and zinc, and to reduce the fever and sore throat and cough. We are not even giving any antibiotic unless there is an infection. And everybody are on home quarantine. We've hardly seen any admissions. At least in Bangalore, we have only 2 government hospitals. Our hospital has not turned COVID yet. We're still doing non-COVID because admissions are very low, and the other hospital, government hospital, also has a lot of beds empty. So most of them are doing home isolation only. And So the most vulnerable people in the Omicron are, of course, children and the older people, but they are also taking a little longer time, but they are also getting better. So we are not even getting investigations done here unless the disease is prolonging beyond 5 days to 7 days. And this number of CT scans have also drastically come down. We don't even get an X-ray unless the disease is severe or they're having cough and then a high fever and then sputum is green, getting into an infective stage. Otherwise, even investigations are lesser and treatment is lesser. But we also have, now they are saying that the risk of prolonged tiredness can be higher in Omicron rather than in Delta. And but the information is limited because we have not gone to that stage where we can tell that, okay, Omicron is causing so many problems. We have to wait and watch for it because we don't have that kind of a study because it's just started now. But vaccine is definitely effective against Omicron. I'm sure all of you have finished taking two doses, but you will need the booster dose, which we are calling the preventive dose, the booster dose. You will need it. And all the current vaccines remain effective against the third variant, Omicron, against the severe disease and death. Maybe because there is already 30 to 40% of people infected with corona, and another 30-40% who have already been vaccinated. This Omicron is also showing lesser symptoms and morbidity. Also, the variant itself probably is not causing such a big severe disease. This is just an epidemiological situation in India. I think the highest was in highest death was in June, July of 2021. And we just testing for Omicron, which shows which receptor is blocking and all that. And I've already spoken to you about management of COVID, either at home or in the hospitals. Vitamin C, tablet, zinc, and all that are immune boosters. So this was all about home isolation. One more thing we're trying to give now is nebulization with inhalation budesonide, which is helping for the cough. And of course, we had different treatment for different comorbidities like diabetes, hypertension, coronary artery disease, chronic kidney disease, because there were some medications which we could not give, and then we had to manage their sugars because it would go very high because of steroids. So all those were treatment that we started as and when we found the complications. And we had something called COVID care centers. Even now we have, because a lot of people don't have places to isolate in their house. A lot of them stay in a 1-bedroom or a 2-bedroom house. There are 4-5 people there, so they cannot quarantine there. So we have something called COVID care centers, where these people who are not sick but they can't have a quarantine can come and stay here, and their only symptomatic treatment is being given there. And now for severe diseases in Omicron, there is something called molnupiravir. It's an oral antiviral, which we are starting, but this is only in severe cases, which is not too much actually. It's less than 10 to 20% of them are on molnupiravir now. This is all management of, I've already spoken to you about antiplatelets, antibiotics, and all that, and how we did all the investigations. Since we are not doing all this investigations for Omicron, I'm not going to repeat the same thing again. Thank you. Now I'm open to questions. That will be more interesting because I'm sure a lot of people have a lot of questions to ask.
Thank you, Smitha. That was a lot of information. A few things were like little above us to understand the actual things about the virus. Thank you so much for. Yeah,
but I hope it was not. No, but I hope it was not too much to understand, and I hope you all like kind of
no.
Get the gist.
Somewhere I feel. Yeah. We got a better gist about everything. Definitely, yes, okay. Yes. Thank you so much, and. I would like wholeheartedly thank the frontline workers, all the doctors, nurses, and the frontliners who've been like tirelessly, selflessly working till date to fight the health crisis.
I know.
Just one big thank you.
I know, because what happened was right now also everybody in my unit are positive, but we are still continuing to work, taking turns, because it's a milder disease, and so many of my friends died during the second wave. So I have seen my close friends in my medical college school, everybody pass away because of this COVID. So I am kind of my concept to life change. I used to say, live for today and don't think of tomorrow, live only for one day. But now I say, live for this meal. Who knows about the next meal?
True,
Thank you,
very
Smitha.
true. It was.
Thank you. Thank you, everybody.
Thank you, Smitha Bangalore.
Thank you.
Thank you, Auntie.
Hello, Auntie. Thank you so much, Akka. Let's move on. Yeah. Let's move on to the question answer session. I can already see some hands raised. If Ragapriya Garu can just call out the names of the people who raised,
yeah,
it will be easier for us to
Yes.
unmute themselves and ask the question. I just wanted to tell she's very fluent in Telugu, English, Hindi, and to an extent Tamil also, Kadaka.
Yeah, I can talk in any language, no problem.
Yeah, so she's very fluent in all the languages. It's not that it has to be only English.
Okay, the first
Thank you.
question.
Over to
Ms. Jeeva Rekha, she has raised her hand. You can ask your question. You can unmute yourself and ask your question.
Jai Vasavi, madam. I have one doubt. Do you have any idea about that booster dose? I want to general information I need. Can you clarify?
Yeah, I already told you need to take the booster, yes. Because we don't know how long the immunity of the second dose lasts. There are a lot of studies going on in the world, the antibody status in your body. So the booster dose is definitely necessary, and I definitely advocate everybody taking the booster dose when their turn comes. And it is the booster dose will act, all the vaccines that is available in India will act on the third variant Omicron also. So I think all of you should take it.
We have to make the same company Covaxin or Covishield or any other brand we can put. That I want to know, madam.
See, actually, mixing of this one is also good, but our country, we have been advocated to give the same dose.
Okay. Oh, so we can go for same company, no?
Yes. We are in India. We are giving only that. We are giving the same
This Covaxin or Covishield or Covaxin, we can go, no?
Yeah, whichever you have taken the first 2 doses, take the booster. Same thing.
Okay, same type of side effect only. It will create.
It is milder. It is milder because you have already been given the first 2 vaccine. So yes, I don't think the body will react more severely for the booster.
Okay, ma'am. Okay, thank you. Thank you very much.
Thank you, ma'am. Next, Vasavi and Radha Krishnan.
Good morning, ma'am. Thanks for a very good insight into what's happening on the background, on the back end. We always see from the front end, but back end, to hear from your own words, we can understand the severity of what everyone has gone through. My question is, can you just shed a little more light on this antibody cocktail therapy? How much, how effective is it, or can we just rely on it and then not go for booster at all? Will it come for a long time?
No, the role of this cocktail and booster is totally different. We are only giving the antibody cocktail when you have a mild to moderate disease. It will only act during the mild to moderate disease, not in a severe disease at all. Like we used remdesivir in a mild to moderate, and we had to use it less than at the before 8th day of your starting of symptom. Otherwise, it was not going to help at all. This antibody cocktail is also like that in a mild and moderate disease. And the role of that is during your COVID. But vaccine is a totally different role. You need to take it to prevent and to get your antibody coverage for, if at all, for a next variant or anything, because we have to live with this coronavirus. It's not going to go away quickly now. We have to live with it, and hopefully it will be like an Omicron, or it will just turn up into a regular flu kind symptoms. Now, even if you're sneezing and all at home and all, somebody else who's with you will also get the same thing. But it is not like you need to be quarantined. So probably it will come down like that, and we'll have to live with it for some more time. So the role of both of them is totally different.
Okay, so my understanding was maybe it was the confusion there where vaccine gives antibodies. So it helps the body generate a lot of antibodies. So why don't we go for antibody cocktail therapy so that we can at least protect ourselves for next 5 or 6 variants? That was the question.
Okay.
Thank you, ma'am.
Thank you, ma'am. Next, Vasavi and Krishna Kumar.
Good morning, madam.
Good morning.
ரொம்ப நல்லா சொன்னீங்க, ரொம்ப யூஸ்ஃபுல்லா இருந்தது எல்லாருக்குமே. எனக்கு ஒரு டவுட் வந்து, இப்போ ஒரு 1 வீக்கா வந்து பாத்தீங்கன்னா இந்த வாட்ஸ்அப்ல நிறைய சோசியல் மீடியா எல்லாம் பாத்தீங்கன்னா வேக்சின் போடக்கூடாதுன்னு சொல்லிட்டு நிறைய பேர் நிறைய சைடு எஃபெக்ட்லாம் வரும், இது ஃபியூச்சர்ல வந்துட்டு 5 இயர்ஸ் வந்து டெஸ்ட்ல இருந்தா தான் வந்துட்டு நீங்க போட்டுக்கணும், எப்படி இவங்க அலோவ் பண்ணாங்கன்னு தெரியல அப்படின்ற மாதிரி நிறைய பெரிய பெரிய டாக்டர்ஸ்லாம் அமெரிக்கால ஏதோ இதெல்லாம் வந்துட்டு இருக்கு. ஸோ அதெல்லாம் பார்த்தாக்கா ரொம்ப கொஞ்சம் இதுவா இருக்கு. அப்புறம் வந்துட்டு இந்த இதை பத்தி வேற நம்ம பில்கேட்ஸ் அந்த இதை பத்தி வேற வீடியோ எல்லாம் பார்த்துருப்பீங்க, நிறைய பேர் பார்த்துருப்பீங்க. ஸோ அதை பத்தி எல்லாம் வந்துட்டு நிறைய வீடியோஸ் எல்லாம் வந்து இந்த மாதிரி எல்லாம் வந்துட்டு ஃபர்ஸ்ட் வந்துட்டு அவங்க ஒரு வைரஸ் இது பண்ணாங்க சிஸ்டமுக்கு, இப்போ வந்து ரிக்ரூட்மெண்ட்க்கு இந்த மாதிரி பண்ணியிருக்காங்க, இந்த மாதிரிலாம் சொல்லி இது பண்றாங்க. ஸோ அதெல்லாம் பார்க்கும்போது வந்து ரொம்ப இதுவா இருக்கு. அது எல்லாம் இதெல்லாம் உண்மை இருக்கா அதுல?
உங்களுக்கு என்ன தெரியும் அதுதான் எனக்கும் தெரியும். ஆனா இது வேக்சின் broken Tamil only, but I'll tell you வேக்சின் பட்டும் லைக் யாருக்கு தெரியாது இப்ப லாங் டேர்ம் என்ன ஆகுதுன்னு யாருக்கும் தெரியாது. இல்ல நான் அந்த லாங் டேர்ம் இன்னும் ஆகல, யாருக்கு தெரியாது என்ன ஆகும்னு. பட் இப்போ என்ன பார்த்திருக்கீங்க நாங்கன்னா வேக்சின் எடுத்த அப்புறமா டிசீஸ் இஸ் மச் மைல்டர். ஏன்னா நான் பார்த்திருக்கேன் ஆல்பால எப்படி இருந்துச்சு, டெல்டால எப்படி இருந்துச்சு, அப்புறமா டெல்டா அப்புறமா எங்க டாக்டர் எல்லாருக்கும் 2nd, 3rd இன்ஃபெக்ஷன் கூட ஆயிடுச்சு. After both the vaccine, 2nd, 3rd infection, ಕೆಲವು பேர் even 4th time கூட ஆயிடுச்சு. ஐசியூல அனஸ்தெட்டிஸ்ட் எல்லாம் ட்ரீட் பண்ணிருக்காரு இல்ல, அது ஏரோசால் வரும் இன்டியூபேஷன் ஆஃப் எல்லாம் ஒரு மவுத் இந்த எல்லாம். ஸோ அப்போ 4th time கூட அவரெல்லாம் பாசிட்டிவ் ஆயிட்டு இருக்காரு. ஆனா எல்லாருக்கும் வேக்சின் 2 டோஸ் வேக்சின் அப்புறமா எல்லாருக்கும் வெரி மைல்ட் டிசீஸ் தான் வந்துச்சு. யாருக்கும் அட்மிஷன் வேண்டாம், ஜஸ்ட் ஹோம் ஐசோலேஷன்ல எல்லாம் நிறைய இட் வாஸ் ஆல் ரைட். ஏன்னா சேம் பர்சன் பிஃபோர் வேக்சின் எவ்வளவு சிவியர் இருந்துச்சோ அவருக்கே வேக்சின் அப்புறமா டிசீஸ் வந்தானா ரொம்ப மைல்டர் இருந்துச்சு. ஸோ வேக்சின் ஹேஸ் ஹெல்ப். நாங்க இப்போ டெய்லி லைஃப்ல எது வாட் எவர் வி சி அதுதான் நாங்க வி ஹேவ் டு பிலீவ். ஸோ லாங் டேர்ம் வேக்சின் வில் ஹாவ் அ பேட் எஃபெக்ட் அப்போ லாங் டேர்ம் இன்னும் ஆகல. ஸோ வி டோன்ட் நோ வாட் வில் ஹேப்பன் இல்லையா. So and the other pakti like I don't want to comment because we don't know what will happen in the future.
Okay. Thank you. ஆனா நிறைய பேர் வந்து பாத்தீங்கன்னா இப்ப எங்க மதர்லாம் கூட வந்துட்டு பாத்தீங்கன்னா எனக்கு வேண்டாம் அப்படின்னு சொல்றாங்க. she is 80+. ஸோ ஃபோர்ஸ் பண்ண முடியல. ஸோ போடலாமா, போட்டா கெட்டதாயிடுமா, இல்ல போடாம இருந்தாக்கா அவங்க பேச்சு கேட்டு கம்னு விட்டுறலாமா அப்படின்ற மாதிரிலாம் ஒரு இன்னும் வந்துட்டு நிறைய பேர் உள்பட நிறைய பேர் இருக்கு. பட் எது நல்லது எது கெட்டதுன்னு தெரியாமலே நம்ம ஒரு
இல்ல ஆக்சுவலி ஓல்ட் ஏஜ்னா தே ஷுட் டேக் இட் பிகாஸ் அவர் இம்யூன் சிஸ்டம் கொஞ்சம் வீக்கா இருக்கும். ஏன்னா ஓல்ட் ஏஜ் இல்லையா வீக்கா இருக்கும். சோ அவருக்கு இன்னும் மோர் இம்பார்ட்டன்ட். மை ஃபாதர் இஸ் 81 years அண்ட் அவருக்கு கிட்னி டிரான்ஸ்பிளான்ட் ஆயிருக்கும், ஹார்ட் பைபாஸ் ஆயிருக்கும் எல்லாம். சோ நான் இங்க நெஃப்ராலஜிஸ்ட் கேட்டானா ஃபர்ஸ்ட் குடு ஸ்மிதா அது வேக்சினும் அவருக்கு டிசீஸ் வந்தாலும் இட் வில் பி மைல்டர். இல்லன்னா மேஜர் டிசீஸ் வந்தானா அவர் அந்த ஏஜ்ல கோப் பண்ண முடியாது இல்லையா. சோ கொடுங்க நான் எல்லாருக்கும் பூஸ்டர் கூட கொடுத்தாச்சு அவருக்கு.
Thank you, madam.
So I would advocate vaccine. Ipo in the today whatever information we have about vaccine, I would advocate vaccine for everyone.
Thank you.
Thank you, ma'am. Next is our inner wheel president, Malathi Santosh. Please, ma'am. Unmute yourself, ma'am. Unmute yourself, please.
Sorry. Smitha nicely explained everything. Thank you for your sparing time. And I am having one doubt. But after taking the 2 vaccinations, many getting infected and 1 or 2 also got died. My friends, relatives. And after taking the booster also, 70+ age, she got a severe thing like admitting the hospital. But not admitted. What is the procedure? So after taking the booster also it's affecting?
See, after booster, it takes, after any vaccine, it takes about 3 weeks for that to start giving you the immunity. So if it was before that, maybe the vaccine is really not started working, and they would have low immunity. Maybe they have comorbidities like diabetes, hypertensive, kidney disease already, and other immunological disorders within them. So it could be any of them. And yeah, I know even after the second dose, I told you there were not much admissions, even in the ICU, even we have lost 1 or 2 patients even after the second dose, but it could be so many other causes. It could just not be only the virus also. So that way it's difficult to explain why it came even after the second dose, even after the booster dose and all that.
Thank you.
But maybe, yeah.
Next, Vasavi and Purushottam, please ask your question, sir.
Good morning, madam.
Good morning.
I am of 65 years old. I got my second dose by May 13th, madam. But they have registered in their system as of June 3rd. So
Okay.
after 9 months, they are telling you are eligible for March 3rd only.
No
But
problem.
actually, I am eligible for February 13th.
But
What
they will
should I
not.
do?
But they will not give you, because in their records, the date is not, you're not eligible before, but it's all right. It doesn't matter. I mean, you can't do anything else. You have to take it when
We
they
can
give it.
wait for, we can wait for,
Yeah.
madam.
Yeah. You
Even
can.
last, in the first week of Jan, we got some fever, madam. Myself, my son and all we got some antibiotics and we are cured. But
Okay.
when I asked some my friends and relatives in and around Chennai and near Salem, like that, everybody is getting this fever,
Correct.
madam.
Correct. That's what I said. It could be this mild variant only. So it is like, if you thought it was Omicron, then you wait for 6 weeks to 8 weeks before you take your booster. So by the time, I think by March, you will be eligible to take the booster also.
But we don't know whether it is Omicron or not. We don't know, madam.
Yeah, yeah. So, but because it is mimicking the same symptoms as flu, you just take it as it is Omicron only, because otherwise, why will it spread so rapidly all over also?
Okay, madam. We can wait for some time.
Yeah, yeah.
As they are postponing for another 20 days, we can wait for another 20 days and take it by March.
Yeah,
Okay,
it's okay. But then all of us still have to be careful. Wear mask when we go out, maintain social distancing as much as possible, and keep washing your hands. See, how much our government does to like prevent all this, to treat us. It is the onus is on us to keep ourselves away from it as much as possible. So whatever the government is doing, however the virus is behaving, all of us have to take care of ourselves.
Okay, madam. Thank you. Thank you, madam. Thank you so much.
The next question by Vasavi and Divya Balaji. Please, ma'am, please ask your question.
Ma'am, என்னோட grandsonsக்கு ஒருத்தர் 4 years old and ஒருத்தர் 3 years old. சென்னையில schools all closed. In Karnataka, Andhra Pradesh வந்து school எல்லாம் opened. But Omicron வந்து children கூட safe இல்லன்னு சொல்லிட்டு சொல்றாங்க. பசங்களுக்கு வந்து how நாங்க எங்க குழந்தைகளை சேவ் பண்றது அந்த ஓமிக்ரான்ல இருந்து? இன்னும் பசங்களுக்கு பூஸ்டர் எதுவுமே வரல இல்ல. இஸ் இட் சேஃப்?
வேக்சினே வரல. பூஸ்டர்
வேக்சின் பசங்களை எப்படி சேஃப் கார்ட் பண்றது? பெட்டர் ஸ்கூலுக்கு அனுப்புறது பெட்டரா இல்ல வீட்ல வச்சுக்கிறது பெட்டரா? நாங்க பசங்களுக்கு அவேர்னஸ் என்ன சொல்றீங்க?
அதுதான். பட் ஐ டோன்ட் திங்க் ஃபார் 4 and 5 years ஸ்கூல் has started இல்லையா? இன்னும் எங்கேயும் ஸ்டார்ட் ஆகல.
ஆந்திரால ஸ்கூல்ஸ் எல்லாம் ஸ்டார்ட் ஆயிருக்கு மேடம். ஆந்திரால they are going for schools. ஆந்திரால கூட இப்ப ஸ்டார்ட் ஆயிடுச்சு ஓமிக்ரான். இப்போ 60ல ஸ்டார்ட் ஆனது இப்ப கிட்ட 450 வந்திருக்கு எங்க பொண்ணு ஊர்ல. பட் they have not closed the schools. they are phoning. இப்ப அம்மா வீட்டுக்கு வந்திருக்காங்க அவங்க ஒரு 10 daysக்காக. நெக்ஸ்ட் இப்ப போன் பண்றாங்க, நீங்க எல்லா போர்ஷன்ஸ் எல்லாம் ஸ்டார்ட் ஆயிருக்கு, நீங்க அங்க போய் உட்காந்தா எப்படி, நீங்க வாங்கன்னு சொல்லிட்டு கூப்பிடுறாங்க. பட் நான் என்ன தெரியுமா, என்னோட ஃபீலிங் என்னன்னா, ஓமிக்ரான் எல்லாமே ஸ்ப்ரெட் ஆகுது. சின்ன பசங்க அவங்கள வந்து எப்படி சேஃப் கார்ட் பண்ணிக்கிறது, அவங்களுக்கு என்ன அவேர்னஸ் கொடுக்கணும், அவங்களுக்கு எப்படி நம்ம பூஸ்ட் ஏதாவது இன்ஜெக்ஷன்ஸ் இருக்கா, ஃப்ளூ இன்ஜெக்ஷன்ஸ் ஏதாவது நம்ம இருக்கு, அவங்கள சேஃப் கார்ட் எப்படி பண்றதுன்னு தெரியல.
See, what do they say? Till 10 years, children have some kind of innate immunity and solarka. So many vaccines could be like polio, MMR, vaccines we give the kids booster till 10 years booster. So because of all those vaccines that we are giving, flu vaccine, we give to the kids original, the pediatricians would be giving. So because of that, there is some kind of innate immunity in children, which is not so bad for this Omicron and Silvaru. Nanga kuda less than 10 years, romba jasti patients paakle, even Delta nu paakle, even in Omicron kuda romba we didn't see. If it comes, it is coming like flu and it is going off. But if we can tell them to wear their mask all the time, because kids will not understand. They will not understand. Wash your hands, wear a mask, stay away from other children. They will not understand. So I think as much as possible, we can send them. Otherwise, if it comes as a mild flu, you treat them as a mild flu.
Okay, ma'am. இப்போ வந்து சேஃபா மேம் ஸ்கூலுக்கு அனுப்புறது இல்ல நம்ம வீட்ல வச்சுக்கிட்டே ஒரு 2 months வரைக்கும் நம்ம அனுப்பாம இருக்கிறது சேஃபா மேம்? அது சொல்லுங்க மேம்.
That depends on your confidence and your determination. Or other I cannot be telling you what to do, Vilya.
Ma'am, as a grandma, I will not advisable, ma'am. But Andhra parents are very confident. ஒண்ணு வராதுன்னுவாங்க அவங்க. இம்யூனிட்டி எல்லாம் இருக்கும் அவங்க பசங்களுக்குன்றாங்க. So நான் இப்போ எனக்கு நீங்க வந்ததுனால I have an opportunity to speak to you. What is beneficial? நீங்க advantage percentage ஆவது சொல்லுங்க. Okay, 70% is good or 30% is இந்த மாதிரி ஏதாவது percentage ஆவது எங்களுக்கு கொடுங்க. அதை வச்சு நான் பேச முடியும் உங்க கையில. That's why I'm asking you.
That I will not be able to tell you that because inge Karnataka no schools for children in open avle.
Andhra ma'am, Andhra Karnal ma'am.
So the Andhra government will be having its own like knowledge of percentage and the credibility. That is why they are going ahead with their rules. So I don't think I'm qualified to tell you about the percentage of spread in children and all that. But they have a better immunity than the others because of all the other vaccines that we give.
Okay, ma'am. Give last question, ma'am. It is advisable to send the children 2 months வரைக்கும் அனுப்பலாமா வேணாம்? அது மட்டும் ஆன்சர் பண்ணுங்க மேம். Please.
You're putting me in a spot.
Because as a grandma, I have to take precautions. என்னோட பேரனுக்கு அது என்னமோ சொன்னார் பாத்தீங்களா, அம்மா பாசத்துல பாட்டி பாசம் டபுள் மடங்குன்ட்டு. So that's why இப்போ எங்க வீட்டுல கூட கன்வர்சேஷன் அதான் ஓடினு இருக்கு. நான் சொல்லின்னு இருக்கேன் 10 days வரைக்கும் இருக்கணும்ட்டு. எங்க மாப்பிள்ள நோ ஃபர்ஸ்ட் பிப்ரவரி இப்ப வந்தது 10 days ஆயிடுச்சு. பிப்ரவரி ஃபர்ஸ்ட் நீங்க வந்து ஸ்கூல்ஸ் ஆல் ஓபன்டு, எல்லாமே மக்கர சங்கராந்தி ஹாலிடேஸ் எல்லாம் ஓவரு, சோ வரணும்னு சொல்லிட்டு சொல்றாங்க. அதுதான் நானும் பேசின்னு இருக்கேன். நீ உங்க கையில பேசுறதுக்கு சான்ஸ் கிடைச்சிருக்கு. கொஞ்சம் ப்ளீஸ் சொல்லுங்க மேம்.
I will go with the flow of what my state is doing. I will probably send, if everybody is sending and the government feels it's okay there and the credibility is less, I will send them.
Okay, at this juncture, as a teacher from the other end.
Yeah. I think
I feel, if the schools are asking and the school is confident about the sanitization and giving them all the possibilities of social distancing, and if the parents feel it is safe, to an extent, you can send them. This is, I'm not watching it and all. I'm just giving you because you just wanted one advice. This is because I'm talking as a teacher, not as a grandmother or a doctor.
The school is taking enough care on that. I think you can send them.
Okay. We can send.
Ma'am. Sindhu, thank you for giving a teacher's perspective.
I just wanted to tell her because even we have, had children, but there are other things that we'll have to look into also. All the safety precautions are in place, so we have the confidence of sending. We can confidently call in the children.
Okay, thank you. Next question, Shalini ma'am, you can ask.
Yeah, hello ma'am. It was nice hearing to you. I just have a question. When you have the symptoms, whether you need to take a test or quarantine yourself, the basic cold, cough, and fever, it's better to,
see, that is, it's better to test because then you can be totally quarantined and see that it doesn't spread to others, no?
Okay, so whatever symptoms, if you have general cold and cough also, it's better first give for test.
Yes. So that at least it will prevent spreadability, that's all.
Okay. Yeah. Thank you.
Friends, if you have any doubts, you can put it in the chat box also. We are prepared to ask the question to the doctor. You can ask your questions through chat box also.
Yeah, just one question as a message I have got. There are people who are not tested RT-PCR, but they've had all the symptoms. So is it okay for them to take the booster dose?
No. If they're not tested, they're not sure, then they have to wait for 6 to 8 weeks before they can take the booster.
Okay, for any age,
Because
across
now,
all ages?
even if you've not got an RT-PCR and you're having the same symptoms, you take it that it is Omicron. Unless proven otherwise.
Okay.
So you wait for the booster
so
for 6 to 6 weeks, at least, minimum 6 weeks.
Thank you.
6 weeks. Okay, yeah.
Thank you, Smitha.
Madam, I would say I have a clarification rather than doubt. Do you expect next variant?
Even after this 2 years, now March 14th, it will be 2 years. We know very little about this corona. It has so many variants. I think we will have something, 100% we will have something, but it will probably be a milder variant because all of us have got it. We have some immunity. We have taken boosters, vaccines and all that. We will have to live with it, I think, for some more time. It will become like a H1N1, or it will become like a common cold and the flu and all that. And then we will, like, our daily life, it will come sometime, it will go. So probably we will have some kind of coronavirus that we will face eventually also.
Ma'am, will there be a break between variants?
I hope so. I hope so, because we want to go back to our professions and do something. We are forgetting our professions, doctors, as it is. So I hope we will have some break. Yes.
And how long do you expect this Omicron to come down? No idea.
No, that probably in a month it should come down, yes. Because it's a milder variant and it's already going down in other parts of the world. So we were expecting the peak in Karnataka on the 25th, yesterday, today, like kinds, and then it'll already keep going. So by the end of February, we are expecting it to kind of totally come down.
Thank you. Thank you.
This is according to WHO and according to the other, the technical teams all over the world. That is what I'm talking about.
Ma'am, suggest me any immunity drinks, ma'am.
Homemade drinks, all that. I have been drinking this kashayam that my cook makes with tulsi and mint and betel leaf and all the spices and turmeric and ginger, garlic and pepper and jeera and all that. She boils it, everything. She tells me that it is from her mother in Tamil Nadu, some village. So
Yeah,
that
Kabakura drink they are giving.
Yeah, those kind of stuff. Only eat regular healthy vegetables, fruits and all. They have a lot of immunity in them. Our South Indian food has a lot of immunity because we use a lot of turmeric and ginger and garlic and all that. They have a lot of immunity.
Ma'am, nowadays they are telling to take dry fruits also as much as possible to avoid this kind of coronas, Omicron and all. This acts as immunity boosters.
It won't avoid, but they are all good food to take. That's all. Because they have a lot of antioxidants and vitamins and all that. It is good to take all that. Not only for corona, for anything, all of them are good food.
Ma'am, before and all, we will not eat anything. For this corona, we are eating everything to safeguard us. No.
That's good.
That's why.
Anyway, so you can continue doing that.
Okay.
Yeah, dry fruits become regular to our diets.
Yeah.
We will go to the next question. Next question from Mr. RK. Is the medical fraternity looking the light at the end of the tunnel? Meaning, can we expect this to come to a conclusion?
There is always hope in life. Especially for us. Because now I can tell you, Omicron, my whole unit is positive. I'm the only one running my OTs and my OPDs for the whole week, actually this whole week. So I think I think the medical fraternity is the one who's looking for the light at the end of the tunnel compared to anybody else in the world, I think. So we are hoping for it.
Okay, thank you.
I'm sure we will have the light. I'm sure 100% we will have it sooner or later.
Next question from Mr. Sanjay Kumarji. How long should you quarantine yourself from onset of symptoms?
is it Sanjay?
Yes.
Okay. 5 days. Now, either 5 days, if you're asymptomatic, you can come out. Earlier, it was 10 days, then it became 7 days. Now, the WHO rule says just 5 days quarantine. And if you're asymptomatic, you can come out on the 6th day. But if you're symptomatic, you can still come out, but wear a mask and maintain social distancing. But otherwise, 5 days is enough. 5 days of quarantine is enough.
Okay, thank you. Shalini, ma'am, please go ahead.
Hello, yes, ma'am. Is it true that WHO chief has announced this Marburg, a new variant?
Yeah, they have announced it somewhere in Africa.
Africa, around 100 patients have been infected. What is that?
No, we don't know still anything. It is still there. They are still under investigation.
Oh,
and we
so
also have something else called what was that? Delta Omicron, Delmicron, or Omicron or something. One more thing also has come up in South Africa. And all these variants started in China, but the new variants are coming up in
South
Africa. So we
Okay.
don't know still. We don't know much about that.
Okay. Thank you, ma'am.
Ma'am, we will be free on March.
Sorry?
We will be free on March, ma'am, from everything. We can go out. Huh?
Hopefully.
Okay, ma'am. Thank you very much.
Thank you, Dr. Smitha.
Yeah, ఎప్పుడప్పుడు మీట్ చేయాలని ఉంది అదర్ని.
I know, even for us.
Okay, thank you, Dr. Smitha. That was very nice of you to answer all the questions. I guess that was the last question. And just there's one more question which has come in the private message. They just wanted to know if they can start the physical exercising after getting tested positive for COVID. When can they start?
Yeah, see, it is showing a lot of tiredness for at least 10 to 14 days. So you do as much as your body can take, because the first few days your body needs the energy to fight the virus. So we would suggest complete rest, hydrate yourself well, and eat healthy food, and let your body fight the virus. So during that time, at least for the first 10 days, we would want you to take rest and not exert yourself. After that, as much as you can, slowly you can start walking and all that after a couple of weeks only. So don't push yourself, because then you will drain your energy. So slowly you start as much as your body can.
Okay, thank you. I guess that is, yeah, after 2 weeks, sure, thanks. I guess that's the last question. Thank you so much. Thanks a lot for patiently answering all the questions. I request Vasavi and Balaji Garu to honor the chief guest. Smitha, sorry, I'll be taking it on your behalf and handing it over to you when we meet in person next time.
Okay, Sindhu. Not necessary though. Thank you.
Small
Thank you so much. It is just.
Thank you so much.
Thank you for accepting our invitation and spending your time, ma'am.
I couldn't say no when Sindhu asked me, because she saw the same presentation in Bangalore when I was doing it for the round table and all. She said, same PPT, Akka, same thing, you come and do it again. I could refuse.
No, it was very informative. I mean, I should not, I mean, because hardly I know anything, though I've seen it for the second time. It is again new. Thank you so much, Akka.
Okay.
Thank you, everybody, for patiently listening and getting our doubts cleared. Now we have a Republic Day celebration, and I request Sadhya to give a Republic Day speech. Come on, Sadhya.
Good afternoon. I'm Sadhya. I'm going to talk about the importance of Republic Day. Since 1950, every year, January 26th has been celebrated as Republic Day in India. It was on this day in 1950 that the Indian Constitution came into existence. An interesting note here is that India got independence on August 15, 1947 from British rule, which is celebrated as the Independence Day of India. However, on November 26, 1949, the Indian Constitution was first adopted. But the integration of this big nation and unifying the wide variety of cultural diversities was not done until January 26, 1950, that is, when the Indian Constitution came into effect. The governing principle of the Indian Constitution is of the people, for the people, and by the people, which signifies that the power is vested in the hands of citizens of India. Republic Day marks the celebration of the empowerment of the Indian citizens to select their own government. It is a national holiday which commemorates the process of establishment of the Indian Constitution. People in Delhi attend the parade at Rajpath. Beating the cold weather, Delhiites gather in huge numbers and witness the beautiful spectacle. The President of India hoists the national flag and honors the brave citizens of India by presenting bravery awards. Paramveer Chakra, Veer Chakra, Ashok Chakra, Kirti Chakra, and Children's National Bravery Award. The Prime Minister of India pays homage to the brave souls who lost their lives in wars. He lays a wreath at Amar Jawan Jyoti at India Gate in Delhi to show respect to the martyred soldiers. The Republic Day Parade is the main attraction on this day. The Republic Day Parade is led by the three divisions of the Indian Armed Forces, Navy, Air Force, and the Indian Army. Besides this, there are several cultural tableaus, rallies of marching soldiers, military bands, aircraft shows, and displays of spectacular skill, daring on military vehicles. Thank you.
Thank you so much, Sadia. You're refreshing all our facts about Republic Day. Thank you so much.
You.
It is something we had known and it is all faded away in some time. Thanks a lot again, baby.
Hi,
Now
Smitha.
I request.
Hi, Smitha. Gargi here.
Hi, Gargi. How are you?
I'm fine. How are you? Good. I only could log in at the last very little only. I had a lot of net problems. I couldn't join in.
Okay. No problem.
How are you? How's
Good,
everybody
thank you.
there?
All well.
How is the Bangalore situation?
It's okay. We have over 45,000 cases, new cases every day, but it's coming down. It was 50. It's coming down now in Karnataka, I mean. Bangalore is about 19,000 today.
Okay.
Coming down.
Good. Nice to connect with you this way.
True.
Okay, ma.
Hi, Gargiaka. Thank you.
Bye.
Yeah, thank you so much. Now I request Innerville Sakhi President Vaishnavi to deliver the vote of thanks. Vaishnavi, are you there?
Yeah, I'm there. Can you hear me?
Yeah, yes.
I take immense pleasure in delivering the vote of thanks today. I extend my Republic Day wishes to one and all present here. I would like to start first and foremost by thanking our guest speaker today, Dr. Smitha Segu. It was such a clear and informative speech, ma'am. Thank you so much. I'm sure all of us here have much more knowledge about the Delta and the Omicron variants and much more than what we knew at the start of this session. Also, thank you for answering all the questions we had so patiently and clearly. And in such a situation, a global pandemic where there is so much random information available at the click of our phones and everywhere we see, having the right information and the right advice from experts like you is the key to come out of this successfully and healthily. And thank you so much, Smitha ma'am, for providing us with the same. Also, thank you for your enduring service towards this society and also your attitude while you do that. It is nothing much than it's nothing less than inspirational to listen to you. At this point, my speech will be incomplete if I don't thank the frontline workers. Everything from their service to their sacrifices, their everyday endurance attitude is all that we are here for, and they deserve the world's endless gratitude. I would like to thank Sadia for that beautiful speech on the Republic Day. Thank you. And thank you to all the presidents, secretaries, and other EASY members, and the members of the clubs of Vasavi Club, KCGF Elite Chennai, Vasavi Club, Vanitha Elite Chennai, Innerville Club of Chennai, Gemini, Innerville Club of Chennai, Sakhi, and also all the members of Vasavi and Innerville clubs. Last but not the least, I would also like to thank our lovely MC today, Mrs. Sindhu, for playing the key role in organizing today's session and also for carrying out the proceedings so flawlessly. Thank you, ma'am. And thank you again to one and all present here today. Hope we all come out of this global pandemic with kindness and support towards each other. And have a nice day. Stay home and stay safe all. Jai Hind. Now I would like to request all of you to stand up for the national anthem.
Jai Hind. Thank you, PST.
Jai Hind. Thank you, everybody.
Thank you. Thank you.
Thank you, everybody. Bye.
Everybody, thank you all. Nice.
Thank you all.
Thank you. Nice information.
So
Very
beautiful.
good.
So beautiful. It was
Thank
very,
you so
very
much.
nice.
Informative. Very
Thank you,
informative.
everyone.
Hi,
Thank you.
Rama.
Hi, hi.
Nice to see you.
Gargi,
Very
hi.
nice.
Hello, Gargi. I think Gargi is there. My old relative friend. Gargi, hello.
Sorry. Hi, Ka. How are you?
How are you, Gargi? Where are you? Now only I saw your snap. Nice. Nice to see you.
I'm fine. I'm fine. How are you?
Fine, yeah.
Sindhu, it's a
Fine,
great,
fine.
it's a great thought you brought her to our this thing, and
Yeah,
so
we
many
used to,
doubts
yeah.
were cleared. And thank you so much.
Oh, yeah.
Mhm.
Thank you. It's my
Very
pleasure. I
informative.
was always wanting to have her on board. I was just waiting for a
What the
chance.
doubts we don't get also others when they get, oh, okay, this is also
Yeah,
a doubt.
exactly. Yeah, correct, correct.
That
Correct.
kind of,
Right, right.
To ask, yeah, correct.
yeah.
Yeah.
Thank you
It's
so
easy
much.
to connect to
Sindhu,
her.